I'm Dr. Jane. I'm a naturopathic doctor and a natural fertility expert, and I help couples who have been struggling with infertility for more than a year get to the root cause, heal, and conceive naturally. I believe that pregnancy is a natural process, so if it's not happening, something is missing. And so on this podcast, I discuss all things natural fertility, how to understand and get to the root cause of why you might not be getting pregnant or staying pregnant, and more importantly, things that you can do to take control of your fertility journey. I get a lot of questions about saunas, how long to do it, how often, are they good for me when I'm trying to conceive? What about my male partner? I heard it wasn't good for their sperm. So on this podcast episode, I want to go through the research and some benefits of saunas, of how long to use them, how often to use them, and even some things that you can do to optimize your sauna experience. But I want to make sure that you understand that this is not medical advice. And I would advise you to talk to your healthcare provider. And it's probably not going to be your conventional care provider, but your functional medical doctor, your naturopathic doctor, to help you understand what is the best practice for you when it comes to saunas. Because I love saunas, you guys. I grew up with saunas. So I grew up in Russia until I was about 12 years old. And banya is something that we did all the time, which is basically a hot house. And we did that on a weekly basis. That was a time that you went and you got really cleaned. You would get to sit and sweat it out. And I remember doing this as a kid, not a super young kid, but I think at 6 years old, we started to go with my parents. So there's an insane amount of benefits when it comes to saunas. And I'll talk about some of the ways that I get my males to do it versus the females. Even though this is a place where you're going to get hot and you're going to sweat, I do not put them in the same category as hot tubs. So if you've been struggling with infertility for a while, this is probably something that you've heard, that males should avoid prolonged use of hot tubs, I should say. This is if you have a hot tub or you're using a hot tub on a regular basis, let's say after every time you go to the gym, that's going to be different than like every Christmas you go to the ski chalet and then there's a hot tub there, and once a year, 2 or 3 times of that week you go in a hot tub. That's not going to be the thing that deteriorates your progress or prevents your male sperm count to be from where it's supposed to be. I have a lot of patients who have stopped living their lives because of infertility, and I'm very cautious to give any advice before I know people and their cases, their health history, their lab markers, because if infertility is something that you've been struggling for a long time, you probably can resonate with that you kind of feel like you've just stopped living and you're waiting for that next thing to come along, and it just hasn't come along yet. So if that means relaxing and going to a hot tub once a year for 3 or 4 times a week while you're doing that, to me, it's like that's not the big mover, so we're not going to worry about it. But honestly, I do not consider hot tubs and saunas as the same things, because I genuinely do not think that they are. Even sometimes steam rooms and saunas, I like to separate those, because I'll talk a little bit about that, but the steam room, it's going to depend on the quality of the water that's coming through and that's steaming, because if you're steaming water that is toxic, that has a bunch of heavy metals and environmental toxins, and then you're breathing that in, it defeats the purpose. Whereas like a good dry heat sauna that's getting you to sweat those things out is going to be much more beneficial. So let's talk about some of the benefits of the saunas. The way that I make decisions for any one of my patients in terms of, is this a therapy that I'm going to do or is this a therapy I'm going to avoid, is weighing out the pros and cons. So if the pros outweigh the cons, that's something that we're going to do. If the cons outweigh the pros, that's not something that we're going to do. For example, diet is something that's really hard to change. And so if I ask my patients to change their diet drastically, let's say I want to put them on a carnivore reset diet, and that's going to cause them a lot of stress, we're not going to do that. And there's other ways to start to incorporate, whether it's losing weight or getting blood sugar regulated, like your insulin, or regulating even some testosterone and estrogen. There's other ways to do that. We don't want to stress the body out, whether it physically stresses the body out or mentally and emotionally, the body processes it as the same. So the benefits of sauna for me outweigh any cons that could be coming with it. And I'll talk a little bit about that, but there's truthfully, there's so many benefits that I have a hard time telling people that they shouldn't sauna because they might heat up their testicles too much or maybe their ovaries, in which case I really don't think that that's the case that's happening. It's not something that I've seen in my clinical experience at all. And I'm not really seeing it in research as well. So benefits of sauna. The first and foremost, it's going to help support detox of environmental toxins. So heavy metals, BPAs, BCBs, phthalates, those things will literally come out on our skin. And one of the practices that I use with my patients as you start to sweat is to actually make sure you wipe that sweat right off your body so it's not sitting on you and you're not absorbing it back into the system. And I test all of my patients so I have a good idea of their environmental toxic load. If they have a high environmental toxic load, they're going to dump a bunch of those toxins out, especially when they first start to sauna. And so we want to make sure we wipe that off and we don't keep it on the skin for 20 or 30 or 40 minutes before you get to the shower and wash off. We want to keep wiping it off as the sweat is coming through to make sure that we're just getting rid of these toxins and we're not reabsorbing them back in. The other cool thing is that saunas will actually mimic low to moderate exercise. So it increases your heart rate and increases your body temperature. Now, it's not to say that you shouldn't exercise, but this is actually a really great way to get your heart rate up and get those heat shock proteins up and, like I said, body temperature up. That has the same effect as this low, moderate intensity exercise, which is super cool. It's like exercising without exercising. Now, you're not going to build muscle in the sauna, but it is a really great way, like I said, to improve your cardiovascular health. And we'll see a lot of the research and studies is around decreasing cardiac arrest, cardiac development, any disease in the cardiovascular department, and even, of course, diabetes and insulin regulation. Saunas will increase fat burning. It prevents muscle loss by increasing production of growth hormone. So when you're sitting in a sauna, you're stimulating growth hormone. It increases red blood cells and plasma volume. So it improves your oxygen transport. That's really good. We want blood flow to all of the areas in our body. It improves insulin and glucose levels. It also, of course, helps to promote muscle relaxation. I don't know anybody who goes into the sauna and says, I feel stressed after that. You literally feel the tension melting away, your muscle tension. It increases endorphins, and it kind of goes hand in hand with that exercise that you do. It increases your metabolic rate. It improves mitochondrial function. So mitochondria is super important for fertility. If you've been struggling with infertility for any amount of time, mitochondria cannot be overlooked. Our mitochondria helps us make energy. It also helps us make our sex hormones like testosterone, estrogen, and progesterone. It helps us make our cortisol, which is our stress hormone. So when people say they have adrenal fatigue, that is an outdated term. And really what it means is you have mitochondrial dysfunction. And I would say 99.9% of my patients have some sort of hormonal imbalance, whether it's a cortisol issue, whether it's testosterone, either low or high for both males or females. Usually the males are on the low side. Females can be on the low side or on the high side. Low progesterone, high estrogen. So that, and then of course, low energy. We have to look at the mitochondria when we look at the cellular level. So when you're sitting in the sauna, you're turning up all of these incredible benefits. So we cannot overlook this. And there's different sauna types. There's the traditional Finnish sauna, the dry sauna, there's the steam and the infrared. And I'll kind of tell you which one I like the best. For me, the traditional Finnish sauna is really great. I love the dry sauna and I love the infrared sauna. The steam sauna, you have to know what kind of water is coming through and being steamed. That's my only gripe with it. So if you have control of that, then I think it's great. But other than that, I try to stay away from it because the last thing we want to do is think that I'm doing something really great for my health. And then here you are inhaling heavy metals and chemicals and toxins that we're now seeing in our water supply. So we want to make sure when we're doing something good for us, it is actually good for us. How frequently should I use a sauna? And then how long and kind of the temperatures? So again, this is something that I walk my patients through on their individual basis. So I'm just going to tell you based on research and then, my own personal and clinical experience. do not take this as medical advice. I need you to go ahead and make sure you have a naturopathic doctor or some sort of professional that you're talking to. So then you're not, this lady on the internet told me I should do this and I did it and then I fainted because you had a heart condition. Just please make sure you have a practitioner that you're working with. How frequently should I use the sauna? It's 2 to 3 sauna sessions per week. There's going to be a 22% lower risk of sudden cardiac death, 27% lower risk of cardiovascular disease or death, 23% lower risk of coronary heart disease. So on average, anywhere between 22, let's say, to 25 of heart disease decrease of any death that's coming through heart disease. Also, huge decrease, 22 to 20% developing Alzheimer's disease or dementia, and then 19% lower risk of developing psychosis. So this is 2 to 3 sauna sessions a week. If we jump that up to 4 to 7 sessions per week, now we're looking at a 63% lower risk of developing sudden cardiac death, 50% lower of cardiovascular disease, 48% lower of coronary heart disease, and then 66% lower risk of developing dementia or Alzheimer's, and 77% lower risk of developing psychosis. So these are really big numbers, and you see a really big jump from 22% to 63%. So it looks like the 4 times a week is the minimum amount that you're going to get the most amount of benefits. Now, this was a shock to me when I first started looking at the data and the research and the numbers. Because again, I grew up with saunas, but we grew up with doing it once a week, maybe once every 2 weeks. And don't get me wrong, there's still benefits of going into the sauna once a week and getting a good sweat and getting a good clean and good exfoliation. It feels really great on your skin. But the actual benefits when it comes to cardiovascular and metabolic and blood sugar regulation and even mood that we're seeing and the way that our brain is functioning, that's not coming unless you're doing this on a regular basis. So 2 or 3 times a week is great, but ideally we're going to get you in there 4 to 5 to 7 days a week, AKA every day. And so this is where I teach my patients a lot about how to actually sauna, because less is going to be more. If this is something that you're going to train your body to do every single day, 4 or 5 times a week, most times of the week, we want to make sure that we're doing it well. We're doing it smartly. Because, of course, there's going to be things that come with it. I usually start my patients with 1 to 2 times a week, and then we slowly work it up. Everybody's going to be different in terms of how they feel. If you feel really tired after your sauna session, you've overdone it. If you feel like you're not sweating during your sauna sessions, there's going to be a couple different reasons for that. Sometimes it's your temperature of the sauna is not actually hot enough, and sometimes it's mitochondrial dysfunction. So to be able to sweat, it takes energy. And what I just talked about is that mitochondria helps us to produce energy. So when your mitochondria is quote unquote shutting down, the first place it's going to shut down is on the skin, on the surface of the skin. I was one of those people that I would not sweat a lot. I would turn really red and hot in my face, but I wouldn't get this dripping sweat on my body. And there was 2 components for me. It was the mitochondria function for sure that I needed some work on, but it was actually my sodium levels as well. I had really low sodium levels because I stopped eating processed foods, and sure, I salted my food, but I wasn't really intentional in making sure I had extra salt. And, I grew up with grandparents who had high blood pressure, so they were told to stay away from salt. And that was something that salt is bad, salt is evil. And so I kind of just learned not to really eat it. But as an athlete, I used to compete in CrossFit and train really hard. It's like, wow, I needed that salt intake. And I didn't actually start increasing my salt until just a couple of years ago, because I didn't know that was the thing that was low. It's something that is so simple. It's really easy to overlook. So it's definitely something that I don't overlook with my patients now, because I learned the hard way. But you're going to start slow and you're going to work it up. And yeah, you're not going to start at 170 degrees. That's really hot. And you have to work your way up to that, just like exercise. You're not going to go out and start running a marathon. You're going to go for walks first, and then you're going to jog, and then you're going to take breaks and stretch and different stuff. So sauna is the same thing. You can start as low as 125. For some of you, that might be way too cold and you're not going to sweat at all. And so obviously we know that we can bring that temperature up. Ideally, you're going to be anywhere between between 140 to 170 Fahrenheit. There's no need to be higher than that. I find less is more. If we're doing sauna on a regular basis every day, 5 times a week, if I can get you in there 150 degrees, 160 Fahrenheit, and do that for anywhere between 25 to 40 minutes, you're going to be able to do that every day. Versus like when I used to go once a week, I would go in and sweat as much as I could and I would get every ounce of water out of me, but then I would crash because I was actually just depleting my electrolytes. So really important to do less and more and work yourself up. And like I said, temperature wise, anywhere between 140 to 170 Fahrenheit. The question is like, well, how do I know which temperature I need? Basically, what I want for my patients is I want them to sweat for 10 minutes and then they need to get out. So it should take you about 10 minutes to start sweating and then another 10 minutes to like really start to sweat. And then max, we want to get 10 minutes of like that drenching sweat pouring off you, and then you need to get out. So I don't want my patients to sweat for longer than 10 minutes because I want to help them detox a lot faster. It also helps, like I said, with blood sugar regulation, fat burning, insulin, metabolism, and a lot of my patients have issues with those things. So we're going to put them in the sauna to help increase and speed up the process. And it really helps to bring blood flow to all of our tissue, which is fantastic because blood flow is how our body is going to heal. But the thing that we're trying to do is detox. We're trying to get a bunch of crap out of the system. Because again, I look at the labs and I see it. And honestly, like we are all exposed. It's not a matter of if we're exposed to toxins, it's a matter of how much. And so we need to incorporate these practices that help us get rid of stuff more naturally. We want to make sure that we're hydrating. I love to use the electrolyte called Element, LMNT, because you're drinking salt, but it's very well flavored and they have a good balance between magnesium and potassium and sodium. They have great flavors. It's just sweetened with stevia. So it's a really good, that's something that I drink every time I'm in my sauna. And like I said, that first 10 minutes is when you're going to dump most of the toxins. You want to go ahead and wipe it off as you're sweating. And I usually am sitting on a towel, and you can finish with a cold shower if you want to. I typically just finish with a warm shower because I'm doing it at nighttime. So I don't want to rev up my system. If I take a cold shower, I'm going to be pretty stimulated and I don't want to do that. But you can totally do a cold shower or a cold plunge if you have one right after a sauna. It's a great time to do it. It's kind of like doing that hydrotherapy. Blood flow increases, blood flow constricts. And when you constrict the blood flow, it goes all to your organs, your liver, your kidneys, your gut. And then when you let the system warm up, it's like that clean blood is going all the way out to the extremities. So it's a really great way to practice doing hot cold therapy. Now I'm just talking about, hey, everyday use versus like I'm on the weekend and I'm going to do 3 or 4 different sessions. So I'm going to go into the sauna and then the cold plunge, the sauna and the cold plunge. And that's really great to do as well. That's not something that you're going to do on a daily basis. That's more of a special occasion thing. And the same rules apply. You don't want to sweat an insane amount. You probably want to sweat for 5 minutes, just warm up enough so you can do the cold plunge and then go in the sauna again, sweat for 5 minutes. It's going to take you some time to get to the sweating, but get to that good sweat again and then make sure you're rehydrating, make sure you have enough calories because producing sweat takes a lot of energy. So you just make sure you don't want to tank your system. Now, some of the things in terms of male fertility, I do Okay, so what sauna do I use? Honestly, I find that there's so many different saunas out there now, which is great. If you have the ability to do a sauna that's inside your house, like an infrared, or one that's outdoor. Again, they have a dry sauna or they have infrared. Infrared is nice because it penetrates the skin a little bit deeper, so it has a bit more of a healing properties, but any saunas are going to be good. The steam room, again, I'm going to make an exception there because I want you to know the quality of the water. If you're steaming poor quality water, you're just inhaling all of that. So like I've had patients who've gone to a steam room, especially in like a hotel or whatever conference they went to, and then they had this like huge raging sinus infection after because they just inhaled all the stuff that they thought was being good for them, but in reality they just inhaled a bunch of whatever was in the water, and it really aggravated their sinuses. So it doesn't matter too much what sauna you use, it's just kind of a preference. What I have really liked, so we've had an infrared sauna outdoors. I've also grown up with a standard kind of dry sauna, and I love both. Then we switched to the Therasage little personal sauna, and I have absolutely loved that because it's 30 to 40 minutes max being in and out. There is no time that it needs to warm up. Like it literally warms up within 2 minutes. I sit and I turn it on and I start to feel it hot within a couple of minutes. And it's like super compact. You can put it in the corner of your living room. I have some of my patients put it in their bathrooms. It's super easy to use, and I would say it's very budget friendly. So you're not looking to invest 2, 3, 5, 10 grand into like an outdoor or an indoor sauna. This is going to be $1,100-$1,200 where you can get an incredible sauna with red light therapy that only takes 30 to 40 minutes. It goes up to 170 Fahrenheit, I believe. So I have been really, really happy with that. I do have a discount code with Therasage. I believe it's Dr. Jane is the code for 10 or 15% off. If you guys are looking to try it out, I highly recommend it. That's the one that you see me make all the videos in my Instagram. You can pop your head out, but I find if I'm in there, then I get the red light on my face, and I want to be able to sit and like I'll bring my gua sha in and I'll do some lymphatic drainage work, or I'll do a little bit of dry brushing in there just to get things moving even more, and it feels really, really great. So I hope you guys found this helpful. I definitely recommend it for fertility. I think the pros outweigh the cons, and just for your overall health. And like I said, for my male patients, if I'm concerned about their sperm counts, I'll be on the cautious side and I'll get my male patients to sit on an ice pack while they're in the sauna. But otherwise, it's such a great therapy, and everybody I know feels so amazing after doing it. Like your skin glows, you lose weight, you sleep better, your mood is better, and that's just sitting in a sauna for 40 minutes a day. All right, you guys, thanks so much for tuning in. Please share this with anybody who you think will find it helpful. I appreciate every single one of you for tuning in and listening. And if you haven't had a chance to rate the show, I would appreciate it if you could. All of your support means the world. So thanks so much for being here. Thanks for tuning in, and we'll see you next week.